Assalamualaikum warahmatullahi wabarakatuh, and salam sejahtera to Miss Zalina binti Muhammad Desa, lecturer of ADS504, subject of Malaysian Economy of UiTM Sarawak branch, Kota Samarahan campus, and also to our fellow course-mates of the faculty respectively. My name is Suryani binti Seman, and my group for this subject consists of two other members, namely Emilia Ana Josesili and Muhammad Idris Shah bin Hazir. For this assignment, we agreed to choose pandemic COVID-19 issues affected economic growth and society. I will begin presenting starting with the introduction. The severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 causing a global outbreak of the novel coronavirus illness or COVID-19 is known as the COVID-19 pandemic. It was discovered in Wuhan, China in 2019, and since then it has quickly spread throughout the world, and WHO proclaimed it to be a pandemic, emphasizing the urgent need for international cooperation and containment measures to lessen the effects on society and also on human health. And the global outbreak somehow has impacted on Malaysia's economic and also society. Issues related to economic impact of COVID-19 in Malaysia. The COVID-19 pandemic has caused significant economic disruptions in Malaysia, causing recessions and job losses. The government's lockdowns and travel restrictions have led to economic contractions in industries like manufacturing, services, and tourism. The economic impact of the pandemic is influenced by GDP growth, jobless rate, and government initiative. The decreased in export and import activities. The pandemic has led to a decline in export and import activities in Malaysia, affecting commercial activities and supply chain. The global economic recession and supply chain issues have added to the burden on the country's economy, despite government's efforts to revitalize and diversify. Is also affected in our fishery sector. The Malaysian fishing industries relies heavily on international trade, but numerous nations' control mechanisms have hindered this, leading to decreased revenue and supply interruptions due to border closures. Rise in unemployment and poverty rates. The pandemic's disruptions of a supply system has led to increased unemployment and poverty rates. Financial difficulties have forced tourism firms to reduce staff or close, causing widespread poverty and affecting other industries dependent on tourism for livelihoods. Tourism sector hit hard due to travel restrictions. Malaysia's tourism industry has been severely impacted by travel restrictions and border closure, reducing tourist numbers and affecting hotel and restaurant revenues. The government has launched marketing campaigns and financial aid to boost domestic travel. Despite this, the industry's path to recovery remains unclear. Despite this, Malaysia's tourism sector is expanding rapidly, contributing to the nation's economic revenue, creating jobs and generating significant foreign exchange profit. Niche markets like medical, educational, cultural heritage, and halal tourism have also grown.
Hello, my name is Muhammad Idrisha bin Hazir and I will present the issue related to society impact of COVID-19 in Malaysia. The first one is health and healthcare system tourism sector hit hard due to travel restriction. The number of tourists entering the nation has drastically decreased. The government has launched a number of efforts including marketing campaign to boost domestic travel and financial aid. Next is education system. The pandemic has had a substantial negative influence on the school system in addition to the healthcare sector. Due to the closing of college and institution, students now have to adjust to learning remotely, which presents its own set of difficulties. The abrupt transition to online learning has brought attention to the digital divide as students from the unprivileged background struggle to get access to the technology and internet connection they need.
Good morning everyone, my name is Emilia Anna Joseph Lee. Today I would like to presentation for implication of COVID-19 issues in Malaysia. The COVID-19 pandemic may have brought many changes to how your life like, and with it at time uncertainty, alert daily routine, financial pressure, and social isolation. First implication is healthcare. The SARS-CoV-2 is highly contagious virus that has spread and caused a global pandemic. The pandemic have potential to detrimentally affect society and burden the healthcare system. The COVID-19 pandemic has alarming implications on mental health and already stressed healthcare providers should monitor the mental health of their patients and provide them with social support. Second implication is economy and jobless. The COVID-19 crisis has impacts on the supply side of the labor market, and it has major implications for the goal of ensuring full employment and decent work. In particular, the crisis is pushing many families into poverty and increasing existing inequalities. Long-term unemployment has detrimental effect on physical and mental health, and it has been associated with increase in mortality. Next implication is the social and cultural. The COVID-19 pandemic is affecting the public of any community and causing unprecedented disruption of familial, social, and cultural communication and relation. The crisis had effectively increased digital technology use and interaction, but severely reduced face-to-face interaction even among members of the same family. Other than that is implication on education system. With the COVID-19 outbreak, school, universities, and other educational institutes were shut down, and their reopening is still not foreseen soon in many countries. In addition, digital deficiencies and illiteracy, as mentioned before, may have negatively implications to their stay to fight against the pandemic. COVID-19 has become new pandemic worldwide. Many countries face a critical state in managing and controlling the rampant spread of the virus. The pandemic is not only substantially challenging the healthcare system and economic sector, but also constantly putting pressure on government. Other than that is healthcare system and vaccination programs. The government policy to indiscriminately test local and foreigner during contact tracing, active case detection and mass sampling. Most tests were carried out in government laboratories and they were able to cope with the daily demands of testing. The effort complements the use of antibody rapid testing kits that have been used to aid the investigation of this ongoing outbreak and to detect seroprevalence of the virus in the community. The COVID-19 vaccination program or preventive measure to be taken by the government to control and break the COVID-19 infection. Last suggestion is the government strategy has made available several economic stimulus measures intended to preserve rakyat welfare, support business, and strengthen the economy. The objective is to safeguard the welfare of the people and strengthen the economy by supporting individuals and companies facing financial and liquidity constraints. Importantly, recovery is dependent on the magnitude of the shock and strategies used by government in introducing policies to mitigate the intensity of the pandemic faced by communities worldwide.
In conclusion, the COVID-19 pandemic has caused hitherto unheard of economic disruption leading to recession and job losses in several countries. One of the pandemic's main repercussions in Malaysia has been decline in import and export activity. Malaysia is situated on the Sunda Shelf, a thin stretch of continental shelf. For millennia, local fishermen has been collecting marine biological resources in this region. Besides that, two additional noteworthy consequences of the pandemic's disruption of supply network are rises in unemployment and poverty rate. By enhanced movement control order (EMCO) vaccination program, the number of cases of COVID-19 are decreasing.